For years, erectile dysfunction, or ED, was seen as a private, psychological issue, something men suffered in silence. But recent decades have revealed a startling truth. ED is often an early warning sign of cardiovascular disease, the same process that causes heart attacks. Narrowing and hardening of arteries often first appears in the small blood vessels of the penis. This shift in understanding has transformed ED from a source of embarrassment into a crucial health signal. When a man in his 40s or 50s develops ED, it's a prompt to investigate his overall vascular health. Major studies like the Massachusetts Male Aging Study have shown that the blood vessels involved in erections are sensitive indicators of arterial health. Recognizing this link empowers men and doctors to act early, using ED as a clue to prevent heart disease before symptoms like chest pain appear. This knowledge encourages open conversations with physicians about both sexual and heart health. By paying attention to ED, men can make lifestyle changes and seek treatment that may prevent life-threatening cardiac events. The message is one of hope. ED is not just a problem in the bedroom, but a chance for prevention. Instead of ignoring the bedroom canary, we should listen and act. Understanding this connection can save lives. ED is a call to check your heart, not just your sex life. The earlier we recognize the signal, the better our chances for a healthier future. The Massachusetts Male Aging Study, launched in the late 1980s, was a turning point in understanding ED. Researchers followed over 1,700 men aged 40 to 70, asking direct questions about their health and sexual function. The results were eye-opening. 52% of men in this age group experienced some degree of ED. More importantly, the study found a strong link between ED and risk factors for heart disease, like high blood pressure and diabetes. For example, complete ED was 3 times more common in men with diabetes than in healthy men. This was the first solid evidence that ED is often a vascular problem, not just a psychological one. The findings challenged old beliefs and encouraged doctors to look beyond the bedroom when treating ED. ED became recognized as a potential early sign of systemic disease affecting the entire circulatory system. The MMAS laid the groundwork for decades of research and changed how we approach both ED and heart health. Today, ED is seen as a legitimate medical concern and a vital clue to cardiovascular risk. The study's impact continues to shape men's healthcare worldwide. For years, stress and anxiety were blamed for most cases of ED, but science now shows that especially for men over 40, physical causes are far more common. The main culprits? Heart disease, diabetes, high cholesterol, and smoking, all of which damage blood vessels. Atherosclerosis, or plaque, buildup in arteries, restricts blood flow, making erections difficult. ED often appears years before heart attacks or chest pain, acting as an early warning sign. Diabetes is another major factor, damaging both nerves and blood vessels needed for erections. High cholesterol accelerates artery clogging plaque, while smoking directly injures blood vessel linings. Quitting smoking and managing cholesterol are powerful steps to improve both heart and erectile health. ED is rarely just in your head. It's usually a sign of underlying vascular problems. Recognizing this helps men and doctors focus on real, treatable causes. Addressing these risk factors can improve both sexual and heart health. The evidence is clear. ED is a physical issue, and treating it means protecting your whole body. Don't ignore the signal. Take action for your health. Why does ED often show up before heart disease? It's all about artery size. The arteries in the penis are much smaller than those in the heart. When plaque builds up, these tiny vessels get blocked first, long before symptoms appear in larger arteries. Even a small amount of narrowing can cause ED, while the same amount might not affect the heart yet. That's why ED can be the first sign of a bigger vascular problem. Studies show ED often appears 2 to 5 years before heart disease is diagnosed. This gives doctors a crucial window to intervene early. Recognizing ED as a vascular warning allows for timely prevention. The canary in the coal mine analogy fits. The smallest vessels signal trouble first. Early action can prevent more serious events down the road. Atherosclerosis, plaque buildup in arteries, is the common thread linking ED and heart disease. It starts with damage to the artery lining, often from high blood pressure, cholesterol, smoking, or diabetes. The body responds with inflammation, leading to sticky plaque. that narrows blood flow. In the penis, this causes ED. In the heart, it leads to chest pain, heart attacks, or heart failure. The most dangerous moment is when plaque ruptures, triggering a blood clot that can block an artery completely. If this happens in the heart, it's a heart attack. In the brain, it's a stroke. ED is often the first sign of this silent, dangerous process. Recognizing ED as an early symptom can prompt life-saving interventions. The same disease process affects multiple organs. ED is just the first domino. Don't wait for a crisis. Use ED as a warning to check your vascular health. Prevention starts with recognizing the earliest signs. As evidence mounted, medicine changed its approach to ED. The Princeton Consensus Conferences brought together experts to create new guidelines. Their message: every man with ED should be evaluated for cardiovascular risk. Doctors were urged to stop treating ED in isolation and instead assess for diabetes, high cholesterol, and hypertension. Patients were categorized as low, intermediate, or high risk for heart disease. High-risk men needed their hearts stabilized before ED treatment. Most men with ED fell into the intermediate group, prompting a full cardiovascular workup before starting ED therapy. This shift made ED a trigger for early heart disease detection. The guidelines created a powerful tool for prevention. ED became a vital sign for men's overall health. The Princeton Consensus Guidelines have transformed how doctors handle ED. Now, ED is treated as a vascular issue until proven otherwise. For men over 45, a complaint of ED triggers a full cardiovascular risk assessment, covering smoking, diet, exercise, blood pressure, cholesterol, and diabetes. This approach turns a doctor's visit for ED into a chance for comprehensive health screening. If risk factors are found, further heart testing or specialist referral may follow. Lifestyle changes, quitting smoking, eating better, exercising, are the first line of treatment. These steps improve both heart and erectile health. ED is now central to men's preventative care, not just a private problem. The link between ED and heart disease is backed by over 3 decades of research. The Massachusetts Male Aging Study first revealed the connection in the late 1980s. Advances in imaging confirmed that poor blood flow is often the cause of ED. Large studies in the 2000s showed men with ED are much more likely to have heart attacks or strokes. One study found ED carried a risk similar to smoking or family history of heart attack. Meta-analyses involving tens of thousands of men confirmed ED as an independent predictor of cardiovascular events. The evidence is strongest in middle-aged men, making ED a crucial early warning. Today, the connection is a mainstream medical fact. Decades of data have changed how we view and treat ED. Turning research into routine care isn't easy, but the ED heart disease link is now standard practice. Medical societies, advocacy groups, and education programs have spread the word to doctors and patients alike. Clear guidelines like those from the Princeton Consensus make it simple. If a man has ED, check his heart. The rise of ED medications like Viagra brought the topic into the open, making it easier for men to seek help. Media coverage and public health campaigns have empowered men to see ED as a health signal, not a personal failing. Informed patients are more likely to take action and partner with their doctors. This shift in perception is saving lives. ED is now recognized as a gateway to better health for men everywhere. Knowing that ED can signal heart disease should inspire action, not fear. If you're over 45 and experiencing persistent ED, see your doctor. It's a vital health signal. Be open. Tell your doctor you're concerned about both your erections and your heart. Your doctor will check blood pressure, cholesterol, blood sugar, and other risk factors. If problems are found, focus on managing them. This protects both your heart and sexual health. Lifestyle changes are powerful. Quit smoking, eat a balanced diet, and exercise regularly. Aim for at least 150 minutes of moderate exercise per week. These steps lower inflammation, improve blood flow, and support healthy arteries. Treating ED isn't just about sex, it's about preventing heart attacks and strokes. The same habits that help your heart will help your erections. Take charge of your health. Small changes can make a big difference. What's good for your heart is good for your sex life. The discovery linking ED and heart disease is a triumph of modern medicine. ED is now seen as an early warning, an opportunity to check your cardiovascular health before disaster strikes. The 2 to 5 year window between ED and heart events is a gift of time. Use it to make life-saving changes, talk to your doctor, improve your lifestyle, and manage risk factors. Healthy arteries benefit your heart, brain, and sexual function. Our bodies are interconnected. Improving one area helps the whole system. By listening to the Bedroom Canary, you can protect your health and your future. Take action now for a longer, healthier life.